So out of all of the conditions that are out there, I think Shin Splints is like the best name for what you experience whenever you're going through what you're going through, because it really does feel like your shins are like splintering and breaking. My name is Jonathan Zalamea. I'm a primary care sports medicine doctor out of Cypress, Texas. Shin splints is where the muscles that help support your ankle are tugging really strongly against the membrane that sits right in front of your tibia or your shin bone. Whenever those muscles are required to do more than they're expected to do, meaning that they haven't trained up for it or they weren't ready for it, a lot of times it can cause that tight pain and then again feel that really strong splintering-like discomfort in the tibia. Shin splints are very common within my athletes who have to run and jump a lot. And it's also really common in people who recently started a new activity. So over here in Houston, we have the Houston Chevron Marathon, where a lot of our athletes try to go and have that goal of running those miles in January. And whenever people start up with that activity and they start realizing that they have to put more mileage in, those are the people that usually have that type of discomfort in their tibias with shin splints. Couple of things to prevent shin splints from happening would be number one, making sure that you have appropriate cross training. So making sure that you strengthen and stretch your ankle muscles and your leg muscles during exercise. And then number two, something that some people don't really think about as much as your footwear. If you're wearing shoes that don't have enough support for your type of gait, your type of walk, it can make it to where your body has to do a lot more work than it wants to, and it can make it to where this discomfort happens. If you think about the process of shin splints, which is where the muscles are tugging on the bone and the bone is really irritated, we really focus on three tenets of treatment. Number one is you're overusing this area, we gotta rest it. So we usually rest you. Whenever we say rest, we mean decreasing the exercises involving your legs. That doesn't mean that you have to stop working up your upper body, working out your core, but it really means backing off on the exercises that worsen your symptoms. Sometimes we have to use a boot in order to help immobilize you, since we do have to use our legs on a daily basis, but overall rest is what we think about as our number one thing. Number two is that there's a lot of inflammation, so we use anti-inflammatories. And then number three are exercises to help stretch it, strengthen it, make sure that whenever you do get back, you're ready for it. Specific exercises that can help are range of motion exercises of your ankle, and then twisting motions of your ankle where you twist it inwards against resistance and outwards against resistance. All of those in an effort to help strengthen the muscles. Sometimes we have to recruit the help of physical therapy or athletic trainers. Sometimes we can ask you to do some home therapy exercises. Most of the time with these three things though, we can knock it out.